Hi, welcome back to my channel. My name is Pooja. I'm an integrated nutritionist and I work with women who have hormonal issues. And today I'm going to be talking about the important herbs and supplements that you can take if you have PCOS issues. So let's start. As we have identified in our previous episodes that in most cases PCOS or PCOD is primarily an insulin problem. So the best way to mitigate the insulin issue is to have a herb or a supplement which can improve your insulin sensitivity and help you take that sugar into your cells which is floating in your blood. Now if you go from medical protocol, then you would be given metformin, which has a lot of side effects, but a very good supplement which can actually do the same job as metformin is now available, and there have been a lot of scientific studies that have been done on it and they have had some really good results with it, and it is called myo-inositol. So myo-inositol supplement can really help if you have insulin issue which is feeding into PCOD, specifically if your PCOD is actually giving you a problem related to infertility. So you have PCOD and that is feeding into your infertility problem, because in such cases you're not ovulating properly, and myo-inositol supplement actually helps in ovulation. It helps in that production of that good quality egg that you're looking for if you have a PCOD problem. So that is an excellent supplement for someone who has insulin issue and they have infertility related to PCOD. In general, cinnamon really works in improving your insulin sensitivity, so just having a lot of cinnamon in your food will really help. There is another herb that is very famous in central India. It is called gudmar, and that is again really helpful in reducing your insulin levels in your body, and that is something that you might want to look at. Other than this, chromium supplement also helps in the uptake of insulin. So if you have too much insulin in your body, then chromium supplement really helps in that case. So you might want to look at that if you think that your PCOS or PCOD is because of insulin problem. Now, if you feel that your PCOS is because you need to figure out why this PCOD is, where it is emerging from. So if you look at my previous episodes, you will be able to establish, okay, might be this is the problem from where it is coming. So once you've established that, then you can then decide which supplement might work for you better. So now if you think that your problem is arising more because of liver problem, that you have been identified that you have a fatty liver issue, then supplements related to liver health will really help. So for example, choline supplement really helps in improving your liver health. So that is found in poultry and eggs and things like that. So just taking choline supplement can really improve your liver health. The other very general easily available herb is neem. It is really very cheap. It is easy to source it. You can take neem capsules every day, and that can really help in generally cleansing your liver. Other than that, apple cider vinegar and lemon, just making a drink with that and just having that regularly will really help in boosting your liver health. And if you feel that your liver actually is not producing enough bile, because that's what it needs to do. A healthy liver produces a lot of good bile, which then digests your fat. But if you feel that you are not producing enough bile, then having bile salts as a supplement can really help in improving your liver health. If you feel that your problem might be arising from your gut, because that is where the problem is, and that could be feeding into your estrogen issue and then eventually your PCOD problem, then taking a good pre and probiotic supplement for 3 months really can make a huge difference. If you feel that you've been on a lot of antibiotics in the past, you've taken a lot of medication because of which your gut is really in a compromised health, then taking digestive enzymes can really boost your digestion, and that can really help. Other than that, if you feel that you have constipation and you're not eliminating every day and you're not going to the loo every day, then taking isabgol, which is a very good fiber supplement, can just add that fiber to your diet and then help bulk up the stool and help you eliminate every single day. Now, if you have a high estrogen problem, high estrogen you can identify if you have high estrogen when you have very painful breasts or cystic breasts, and you're just before the cycle you have a lot of pain in your breast, then that could be a problem related to high estrogen. And taking a DIM supplement will really help in eliminating the excess estrogen from your body. Like I had said, eating cruciferous vegetables every single day can really help to give you that DIM component naturally, but if you can't do that, then maybe taking a DIM supplement will help. If you feel that your problem is arising because of an underactive thyroid, because sometimes thyroid can be very tricky. The scales might look okay and your test might come out normal, but you might have a subclinical thyroid issue, which basically gets picked up if you have general lethargy and fatigue in your body and you're not able to move around very quickly. Then that can be an indication of an underactive thyroid, and you're not able to lose weight because you have low metabolism because of underactive thyroid, in which case you really want to boost your thyroid health. And for that, what really works is iodine, and iodine is naturally available in sea kelp. So if you take a sea kelp supplement, then it has a lot of iodine, natural iodine in it, and that can really work with your thyroid and also ovaries. Your ovaries health is highly dependent on how much iodine you have in your body, so taking a sea kelp supplement can really help. And if you feel that you generally have the PCOD, the classic symptoms of irregular periods or long cycles, or the cycles have gone missing for a couple of months, or you have been bleeding for a very long time, extensively longer time, then a herb called chestberry extract, which is also called as Agnus castus. It's one of the best herbs that you can take for PCOD, and that generally really works. So that is something that you might want to try. The other one is if you have a lot of period pain. So you're generally, your periods are very painful and very crampy, and it becomes very uncomfortable for you for the first couple of days. And then supplementing yourself with vitamin B6, magnesium and vitamin C. These three in a good combination can really help with your period pain issues. Other than that, you also do want to get checked your vitamin D levels, because that should always be on mark. Then B12, there's another one that is very common, and you must get that checked because that might be feeding into your PCOD problem. The third one is iron, because we lose blood every month. If you are iron deficient, then that could be the main reason for your PCOD problem. And another thing that you do want to keep in check is your thyroid levels. So thyroid levels you have to keep getting checked every 6 months, just to make sure that that is all okay. Now, if you feel that you have a strange amount of anxiety and a lot of low depressive moods, and you're thinking too much and you just can't control your thoughts, and you are having panic attacks and things like that, then having a herb like ashwagandha or brahmi, these are really good herbs which can really calm you down if you feel that you are too stressed before periods, and you have those severe mood swings which are actually not it's basically causing a lot of problem in terms of you be able to think clearly. Then having these two herbs can really help, not both of them, either of them. So ashwagandha is also good and brahmi is also good, so one of those you can use. So really you need to see which of these is troubling you most, and then on that basis you have to choose the right supplement for you. Again, dosage is really important, so you do want to consult a specialist to know how much dosage you want of these herbs, because whatever is available over the counter usually is very low dose. So even if you're taking that supplement, that might not help, because it's so small in dosage that it really doesn't make any impact. So you need the right dosage, you need the right combination, you need the right quality in terms of the company which is producing this. So obviously you have to make sure that you're asking someone before taking these supplements. But yes, you can always point these ones that, oh, I'm actually looking for a good vitamin D, can you suggest me some? Or you can say, I am looking for a good brahmi supplement, can somebody suggest me that? So that would be a nice way to tell people or your specialist or your doctor that you are actually doing your own research about this. With supplements and herbs usually are bioavailable, so they are not that harmful for your body, so you can take it for a much longer term. But if you're taking any synthetic supplements like vitamin D or iron or B12 supplements, then these are chemically made, so they are you have to be careful when you are supplementing yourself with it. You have to ask a specialist, and also you should not take these supplements for more than 3 months, because you should just stop it, because otherwise you can make it very toxic for yourself. So just be careful when you are taking these herbs and supplements, because it can sometimes be, if it is overdone, then it can cause some problems for you. Again, don't rely only on supplements to cure your PCOD. These are really, they will assist you in your journey. So when you make the changes in your diet, your lifestyle, your movement, and along with that you start taking these herbs, then they really will assist in that journey. They will not be the only ones that okay, I'll pop this pill and then everything will be fine. It will not work like that. So supplements are supplements. So you're supplementing your existing protocol, and that's how they work best. Other than this, there is a very old Ayurvedic way of regularizing your periods is by drinking moon charged water. So we all know that our cycles are 28 days, and even the moon cycle, which is a lunar cycle, is also 28 days. And there is an amazing amount of link that is there between our cycles and the moon cycle. So in Ayurveda, they usually what they do is they ask you to take a glass of water and keep it under the moonlight and leave it for the night, and then have that water in the morning, and that actually really helps with syncing your cycle with the lunar cycle, and that really helps as well. So that is something that you might try. It's free, it doesn't harm anyone. You can just cover the glass with something translucent, so that the rays actually do fall on the water, but you also don't want certain things to fall into your water. So you just cover it with something translucent, and then let the rays fall on that water, and you can use that as something that you drink first thing in the morning. Now there are a lot of women who actually are so desperate because they haven't had a period for 3-4 months, and they just want that period to come. And then they have to go to the gynecologist to get that pill so that they get their period, because they feel so uncomfortable in their bodies. So if you are someone who really is looking for that quick solution, that you want to get your period as quickly as possible and as regular as possible, then a treatment of acupuncture can really help. I vouch for it in a big way, because I have had acupuncture treatments myself when I was going through infertility, and it really works. If there is some stagnation in terms of your energy in this lower pelvic area, and when they puncture you at certain meridian points, then it helps to release that energy or blockage of energy that is happening in those areas, and then you start getting your period. So that will really help if you're looking for a quick solution but you don't want to really go down the allopathy route. Then maybe getting an acupuncture or acupressure from someone who knows, because there are lots of acupuncturists, but there are some of them who really deal with all the women who have hormonal issues. So identify that kind of an acupuncturist in your city, get few sessions with them, 3 or 4, and see, it might really help in getting your period. And again, long term, if you feel that PCOD is something that has been troubling you for years, 12 sessions in 3 months can really help in giving you that kickstart that you're looking for elevating your PCOD symptoms, and then rest everything can then follow. Again, homeopathy has some amazing remedies which can really help. Again, you have to be patient with homeopathy. There are small doses given to you, and you have to take the homeopathy in very long term to get the actual benefits. So homeopathy also has some amazing remedies that can help with PCOD. So maybe try that out if you feel that homeopathy might work for you better because you've known your aunts having it or your mom having it, and you feel that it really works. Then maybe that is something that you can definitely try. So yes, this is all what I wanted to talk about herbs and supplements. If you feel that you have any particular questions regarding herbs and supplements and what dose to take and things like that, you can always put your questions down on the comment section, and I'll be happy to help. If you feel that this particular video might be helpful to any of your friends, then please by all means share this with them. Subscribe to my channel and press that bell icon that you have in the corner, because that's when you will come to know when I've uploaded my next video. So I look forward to seeing you in my next video. Thank you.